I just want to let you know that this session will be recorded, and please note that the photos will be taken during the webinar and may be posted on our social media pages to highlight this important discussion.
Sunway Medical Center, Sunway City was honored as #1 hospital in Malaysia for both Newsweek World's Best Hospital 2025 ranking and World's Best Smart Hospital. A testament to our unwavering commitment to excellence in patient safety, innovation, and leadership in healthcare. As one of Southeast Asia's leading private quaternary hospital, we're not only shaping the future of medicine, we're also helping to shape a healthier planet. Sunway Medical Center is proud to be a member of the Global Green and Healthy Hospital Network. We are committed to creating a healthier, safer, and more sustainable future in Malaysia and the largest Southeast Asia region. At Sunway Medical Center, solar panels and eco-walk bridges generated over 530 megawatt of clean energy in 2024, reducing our carbon footprint. An advanced building management system optimizes lighting, air conditioning, and power usage, cutting down energy during off-peak hours. We also use oil-free magnetic bearing chillers, which are more efficient, saving up to 40% energy compared to conventional system. LED lighting is now a standard across most of the hospital towers, with motion sensors in stairwells. Sunway Medical Center actively segregates waste in food, recyclable, general and e-waste, supporting the circular economy while providing necessary trainings to our staff to recycle correctly and responsibly.
Di Sunway Medical Center, kami bekerjasama dengan Senviro, sebuah syarikat berlesen yang berdaftar dengan Jabatan Alam Sekitar untuk mengitar semula sisa klinikal yang tidak tercemar. Sebagai salah seorang ahli komiti untuk Sustainability Committee, saya amat bangga dapat menjayakan program yang dianjurkan oleh hospital kami iaitu Sunway Medical Center, Sunway City.
Through a partnership with Senviro, a licensed waste management company, our non-contaminated clinical waste such as IV drips and bottles are being collected and recycled, diverting away from incineration. Food waste is composted on site, supporting landscaping, while fruit peel enzymes are repurposed for eco-friendly cleaning. Single use of plastics are reduced by switching to reusable containers and water dispensers. In our hospital kitchen, cooking oil is recycled into biofuel by our licensed vendor. The hospital also repurposed its linen, converting to eco-tote bag that the hospital's cleaning staff can use. The eco-walk links the hospital to nearby facilities, encouraging walking and reducing vehicle use.
Our hospital began its sustainability journey by focusing on waste reduction and energy savings. From there, we have expanded our efforts into food services, procurement, and greener operations. Sustainability in hospital is important because protecting human health also means protecting the environment where we work and live. Being part of the Global Green and Healthy Hospital Network connects us to a worldwide movement of healthcare professionals who believe that healthcare must be part of the solution to the climate crisis.
Sunway Medical Center sustainability effort is more than a showcase. It's an invitation. Together, we can learn to be inspired and build greener, healthier hospital for the future. Join us in this journey towards sustainability. We are all in this together.
Hello, everyone. So before we start, I would just like to request that everyone to rename themselves, name, dash your affiliation or your organization. So good afternoon. I'm Dr. Michelle Reyes, the Sustainability Officer of Healthcare Without Harm. Welcome to the first Health for Climate session of 2026. And this introductory webinar is entitled First, Do No Harm to People and Planet, a Just Transition in Health. This session is specifically designed to raise awareness among our RISE Alliance members, bridging the gap between climate policy and public health. For today's session, we are focusing on just transition and health because by centering the principle of first do no harm, we move beyond financial discourse. We move beyond financial discourse to prioritize the physical well-being of those who have historically borne the toxic burden of energy production, ensuring that the transition protects both the planet and people. So here's a quick overview of our agenda. Next slide, please. So introduction of RISE SEA, and we're going to have two interactive sessions, and we're connecting just transition with social determinants of health, and we will share with you a RISE community sharing. So to give, for the next session, to give an introduction of the RISE Alliance and an interactive session on just transition, allow me to introduce Kyla, our Climate and Health Officer. Kyla, the mic is yours.
Good afternoon. Thank you, Michelle, for introducing me. Before diving into our topic, I would like to introduce Healthcare Without Harm's RISE Southeast Asia Alliance for Health and Climate. We've designed to make this online session as interactive as possible. So please make use of emojis, reaction signs, even the chat box. And remember, there are no right or wrong answers during this webinar. So let's start this off by please sending me your midweek reaction. It's currently Wednesday, so it's 2 days from the weekend and 2 days to the weekend. I see a lot of hearts, so I'm loving this. Oh, so I see a crying face. Any more reactions? Ooh, and the emoji with the hearts. I love it. Thank you, everybody, for participating. So, what is RISE? RISE is a movement of professionals dedicated to building a resilient, decarbonized, and equitable health sector. Located in over 20 countries worldwide, we turn individual experiences and expertise into collective impact. RISE is actually an acronym. If you look at the screen, it means resilience, influence, synergy, and equity. The RISE Alliance strengthens regional resilience and leadership influence to better address the climate and health issues through cross-sectoral synergies and a commitment to equity. This initiative drives transformative climate action for communities and countries across Southeast Asia. And why health professionals? In different surveys and in Gallup's annual poll for the last 24 years, health professionals have ranked as the most trusted profession. And the health professionals are uniquely positioned and skilled as trusted individuals and clinical leaders to take leadership in the environmental and health movement. I will be sharing with you two country projects of RISE. First, in Indonesia, Kebumi, which means Kesehatan Untuk Bumi. Kebumi aims to build an alliance of health professionals on climate justice, health equity, resilience, and health recovery in Indonesia. This is led by Indonesian Health Promoting Hospitals Network and Healthcare Without Harm Southeast Asia. We are also very fortunate this afternoon to have one pillar in the Indonesian health sphere and in Kebumi to be our speaker later, Dr. Suharman. So in the next slide, these pictures do not cover all the work that Kebumi does in Indonesia. But if you see, they conduct workshops, seminars, trainings. They also install and build air quality monitors and so much more. If you want to learn more about Kebumi, please do visit their website, which I have dropped in our chat box. There you go. Next. Second, let's take a look at the Philippines. We have the HACCP, or the Health Alliance for Climate and Clean Air Philippines. This is a partnership of 5 different organizations. If you check your screen, it's listed there. We have the Philippine College of Chest Physicians. We have the Philippine College of Physicians, Philippine Society of Allergy, Asthma, and Immunology, Lung Center of the Philippines, and also Healthcare Without Harm. So in total, this HACCP, this alliance, represents around 20,000 professionals in the Philippines. HACCP works to increase awareness of climate change and air pollution to safeguard public health in the Philippines. So pictures of their work are seen here. If you see the different slides, HACCP has also partnered with the Department of Health in the Philippines by doing many different advocacies and consultations. The one in the lower right, this is an advocacy bike and walk for clean air that has been happening for 2 years now, commemorating the 25th year of the Philippines Clean Air Act. So if you would like to receive notifications, reminders, and be part of this movement, I also like to think as RICE, RICE, as a staple in Southeast Asia. So hopefully this also would be a staple in our movement. So we encourage you to sign up. You can take a picture of the QR code or focus your camera on the QR code that you see in your screens now and sign up. It goes directly to our form. But also to make it easier for everybody, in the chat box, you can see the link. Okay, so that is it for our RICE Alliance. I hope you are as encouraged to join and enlightened to work on the climate action and health movement as I am sharing this with you. Next slide, please. But now, what we really want to do is to hear from you. So our topic for today is just transition. So I have around 5 minutes to hear from you and that we share ideas. If you see here, what we will be doing is a chat waterfall. So I need all of you to listen, to type, and make sure that you have access to the chat button, and then you choose everyone, because I want you to put your ideas in the chat box. But before, do not hit send until I say send. That's when the waterfall part comes in. So that once I say send, I can see many different ideas, many different words, and that's how the waterfall effect comes in. Is this understood? Kindly give me a thumbs up if you understand the... Okay, perfect. All right, next slide, please. So we have a scenario here. Our scenario is that a Southeast Asian Ministry of Health gives a 5-day notice to ban the use of all medical waste incinerators and open burning to eliminate toxic air emissions. All government clinics and hospitals are now mandated to immediately contract specialized transport to send their waste to a centralized non-burn treatment facility in the capital. So that's all over their country, and they have to send their waste to the capital. My question for you is, use the chat box. Our first waterfall, we will be having 2, is what are the wins of this scenario from an environmental or health perspective, or any perspective that you can bring into this discussion. Who or what benefits from this change? what do we consider the wins of this scenario? So a reminder, please type in the chat box, but do not hit send. So I'm going to be giving you 10 seconds to formalize your ideas and then put it in the chat box. And then I want everybody to hit send at the same time, but not yet. So again, what are the wins in the scenario on the screen? Last 5 seconds. 3, 2, 1. Send. I see here reduced air pollution, respiratory health is preserved. Ban alights with the goal of reducing emissions, cleaner air, and also less energy consumption. This will minimize air pollution and sustenance of eco-friendly environment. Any more additional answers? Thank you for those who have participated. These are all what we consider wins for this scenario. Now, let's think of our second waterfall. So take a look, take a second to internalize the scenario again. Our second scenario or our second waterfall is the hidden burden. So with the wins of our first waterfall, if this policy is implemented basically overnight with zero support systems, who do you think carries the heaviest burden? Are there groups of people who might be harmed? So these are your questions that might help you answer. What do you think are the hidden burdens of our scenario? So let me give you 10 seconds. So a reminder, you can type it in the chat box, but do not hit send yet. So who do you think carries the brunt of the scenario that was presented? Okay, last 5 seconds. 3, 2, 1. Hit send. So many answers. So who you thought carries the brunt of the scenario? We have answers like the community, the public, waste transporters, costing is also one consideration. The productions or producers has the advantage in this scenario. That is not good and is considered a false solution. They cover the effects of the people. Sorry if you can hear my dog. The poor of the poorest will be affected for this scenario. The state, patients. This raises logistic concerns as well. Healthcare institutions also carry the weight of this. The general public, the hospitals and its clients in the surrounding environments. So thank you all for participating. So if you take a look at our answers for the first waterfall and the second waterfall, they show us the hard reality. Our first waterfall, the health and environmental wins, are undeniable. That is basically health for all for different generations. And if we just consider this, the policy looks perfect. But then we take a look at the second waterfall. When we enforce different policies, different programs without support systems, we see the real human cost. This is when we bridge the two waterfalls. This bridge being just transition. We need a world free of toxic emissions and also a push for healthier environments, making sure no one gets left behind. But we cannot do this by sacrificing the livelihoods of the most vulnerable people in the process. It is moving to a low carbon, sustainable economy in a way that is fair, inclusive, and leaves no one behind. So to everybody, I hope this leaves you wanting more, wanting to learn more on Just Transition. And with this, thank you for your time. I hand the mic back to Michelle.
Thank you, Kyla, for that introduction and for that very engaging session on Just Transition. And also, thank you to the participants who also engage. So later on, we will have a feedback form. So we hope to have your engagement by the survey. It's just a 3-minute survey. Next, before we listen to our line of speakers, may we turn on our cameras for a photo opportunity. Okay, Porsche, are you taking the photos? Okay.
So, hi everyone. Let's just wait for a few more people to turn on their cameras. Thank you so much for everyone who's opening their cameras right now. We have around 3 pages with us today. So currently we're at 57 participants. Thank you so much. All right. So let's hold in our smiles. 1, 2, 3. Well done. For the first page. And then for the second page, let's just hold on our smiles. 1, 2, 3. And then last page. 1, 2, 3. All right. Thank you so much, everyone.
Thank you, Portia. And I'm loving the energy so far right now with the participants. So I hope to keep that energy going. Our next speaker is Melody Melorike, our Regional Climate and Health Manager. She will introduce Just Transition and its principles. So Mel, feel free to open your mic.
Thank you. Thank you, Mitch. And good day, everyone. I'm Mel. I'm the Regional Climate and Health Manager of Healthcare Without Harm Southeast Asia. And thank you, Kyla, for opening the floor for me because it will be easier for me to discuss Just Transition looking at the responses of our participants for today. So today, I'll be more focused on Just Transition and its principles, particularly from the health perspective. And we know now that climate change is really accelerating, and the question of transition is whether it's not whether or not we will transition, but how do we transition and when do we transition? So, is it a shift that will protect workers, our health, and the vulnerable communities? Or is it a transition that deepens injustices? So, this presentation will give you an overview of why health must be at the center of that transition. So next slide, please. So this slide will show the contents of my presentation. So I have here the 3 main parts. The first one would be the rationale and the meaning of just transition. The second one is the perspective of healthcare without harm, particularly from the report Just Transition for Healthy People on a Healthy Planet. And the third, under this report, we have the 6 guiding principles that can shape action in the health sector. So this presentation will move us from theories to application and to action. In the next slide, I would like to share first the recent report called the Lancet Countdown on Health and Climate Change. So for those of you who are not familiar with the Lancet Countdown, it was established in partnership with Wellcome Trust and is led by the University College London in partnership with WHO and the 71 academic institutions and also UN agencies worldwide. So it is the 9th year. So the report was launched last year, and that report provides the most comprehensive assessment of the health impacts of climate change and the co-benefits of urgent action. So in this slide, I would like to highlight the findings from this report showing that backsliding on climate commitments is directly harming human health. In particular, we take here health adaptation, for example. If it remains underfunded, it means that hospitals and communities are increasingly exposed to extreme heat, floods, and other climate hazards. At the same time, when adaptation is becoming more expensive, it becomes a burden with every ton of greenhouse gas that is emitted. And finally, when there is a reversal of climate commitments, it becomes a public health threat for all of us. And in our region here in Southeast Asia, we have been experiencing this through extreme heat affecting patients and our health workers, floods disrupting health facilities, and air pollution increasing respiratory cases. That is why we see that just transition is really an urgent matter. Without it, our climate action gaps translate directly into health injustices. So in the next slide, I want to give a clear definition of what just transition is all about. So when we talk about just transition, it means creating a fair and inclusive shift when implementing climate and environmental policies. So what are the two key words here that we have highlighted? It's the word fair and it's the word inclusive. So it recognizes that climate policies can prevent vulnerable workers and communities from being bearing the disproportionate burdens. And originally, this framework of just transition emerged from several labor movements concerned about coal workers losing jobs when we transition to decarbonization. But today, the word just transition must expand to include communities exposed to pollution, indigenous and marginalized populations, and importantly, our public health. Because a transition that does not protect health cannot be called just in the first place. So we have to understand that concept. In the next slide, we have here how just transition is aligned to international policies or international agenda. So the just transition framework is actually built on the International Labor Organization's Decent Work Agenda, which has 4 pillars, namely employment, social protection, rights at work, and social dialogue. So from the health perspective, these pillars are deeply interconnected with well-being. For example, unemployment increases mental health risk or anxiety, or unsafe working conditions increase disease burdens, and exclusion from decision making deepens inequities. So therefore, um, health professionals and other allied health professionals that are here today and others have a role in ensuring these pillars are all realized. So let me now put in our report that we published last year, 3 years ago. That is our Just Transition for Healthy People on a Healthy Planet. Next slide, please. So for decades, the conversation of just transition has been echoing different voices, no? So for example, for workers, they would advocate for job security. For the communities that are affected, they would demand for environmental justice. Or for governments and investors, they would highlight the economic side of things. We know that each perspective matters, right? But one thing essential that is missing in those narratives is health. And we at Healthcare Without Harm positions health as the missing link that connects workers' rights, environmental justice, and climate policy. So at the core, just transition is about protecting life, life on Earth, and Earth itself. But if we place health at the center, we don't just change our energy system. We build a future where people and planet can truly thrive. And one classic example here would be the pandemic. We know that when the environment is damaged, the people suffer. Or when the public health systems become fragile, in our economies would falter. So health, our livelihoods, and the planet are inseparable in essence. So we see that in this report, a just transition calls for public health, protecting workers and communities, repairing environmental damage, builds climate resilient health systems, and ensuring that no one is left behind. So while this report really centers on eliminating fossil fuel use, it is important to emphasize that just transition also applies to pollution contributing industries beyond energy. So for example, we have plastic production, we have petrochemicals, we have waste incineration, chemical manufacturing, medical supply chains that are linked to high emissions. So I would just like to rephrase the question that how do we decarbonize? But rather, how can decarbonization improve health, equity, and resilience? So that's the main idea of this report. In the next slide, we have there the 6 guiding principles for just transition by healthcare without harm. So these 6 principles would center on number 1, protection of workers. So that's principle number 1. Principle number 2 would center on protecting the rights to health. Principle number 3 would be prioritizing social, physical, and mental well-being of the communities and the people. The 4th principle would be transitioning the health sector itself. Number 5 would be how to address historical and cultural injustices. Number 6 is how do we move towards decentralized health-centered economies. So these principles actually help translate values into concrete actions. So let's now deep dive into the 6 principles. So next slide, please. So the 6 healthcare without harm principles of just transition, let's start with prioritizing the workers. So this includes securing livelihoods and income, providing retraining, recognizing health harms from fossil fuel employment and other pollution contributing industries, and ensuring that no worker is abandoned in the shift away from fossil fuels. Second, protecting the right to health. So this includes long-term health monitoring in affected communities, polluter-funded cleanup based on the polluter's pay principle, and the compensation to health harms. And we must consider that in order for us to adhere into the protection of health, health justice must be embedded in all of our climate action. The third one is prioritizing social, physical, and mental well-being. So climate transitions can increase stress and anxiety. So we must ensure that we protect infrastructures, address gender inequities, and prevent mental health impacts. The fourth one is transitioning of the health sector itself. That means that the health sector, we know and we understand that the health sector contributes to emissions. So around 4 to 5% of the global emissions are coming from the healthcare sector. So we recognize that we must decarbonize facilities, adopt sustainable procurement, and invest in resilient infrastructure. The fifth principle is addressing historical and cultural injustices. So in this report, we see that many communities have borne pollution burdens for decades. And a just transition must acknowledge past harms and ensure an equitable benefit sharing for everybody. And last but not the least, move towards decentralized, health-centered economies, supporting local economies, investing in community health, and foster circular systems can build resilience and reduce dependency on extractive industries. So altogether, these principles move just transition from theory to operational guidelines. And if you want to have a copy of this report, we can link it later in the chat box where you can download the actual copy. Okay? So before I end my presentation, I would just like to say that just transition is not just about shifting energy systems or reducing pollution. It's about shifting the power, the priorities, and the protection towards health and equity. And we as health professionals have both the authority and the responsibility in this type of conversations. And if we center health, we ensure that climate action improves lives and it does not just reduce emissions and pollution. We must remember that health is a moral foundation and a measurable outcome of a just transition. So thank you very much, and I hope that you will be staying with us until the very end because we have wonderful speakers who will share their knowledge and experience. So once again, thank you, and back to you, Mitch.
Thank you, Mel. So that was a really great session that was introducing Just Transition and its principle. So this is the first session we are introducing this topic on Just Transition and the Healthcare Without Harm publication. So Mel highlighted the need to center Just Transition and health, and this is an important and urgent discussion we need to have health because health is an overlapping but missing link that connects Just Transition. She also highlighted that it is an urgent matter to discuss for a fair and inclusive change in society that benefits all. Now, for the next session, let me share with you the different speakers. So, the next session will be an online human library format. So, an online human library is an interactive dialogue space where individuals, our speakers, will serve like a living book, sharing personal experiences, while participants, so you as participants, engage as readers through some questions. So you are free to chat your questions, but we are opening it as an open forum as well later. I will introduce the speakers, and each of them will tell their stories, and participants are encouraged to ask questions via chat, or you can reserve your questions later on in the open forum. So please note that during the book or the speaker's storytelling, readers can interact via reactions or chat. And if you are relating to their stories and their lives as well. So before we start, please be informed that one of our speakers, Aloha, will be delivering their talk in our local language, and live English interpretation will be available via Zoom. So to access the English translation, look for the interpretation icon at the bottom of your Zoom screen. It looks like a globe. Click on Interpretation and select English. So you may also adjust the audio balance if you prefer to hear more of the original audio or only on the interpreted channel. So if you are joining via mobile, tap the three-dot button and select Language Interpretation. Choose English. So for Aloha, I will remind later on that to select English. But for now, let me introduce our first speaker, Daru Setiorini. She is the Executive Director of Ecoton. She is an environmental biologist and has been involved in environmental pollution studies and their impacts on ecosystem health and communities. She advocates for toxic pollution control on hazardous waste treatment, plastic chemicals, and microplastic contamination from dirty recycling practices in Indonesia. She joins global advocacies to ban waste trade from developed countries in the guise of recycling, but sacrificing environmental health and people. So, Daru, the mic is yours.
Thank you, Mitch. Good afternoon, everyone. I'm so happy to be here. Thank you for having me. So I will share my screen from my laptop. I think it's not the right file. Yeah, okay. Can you see my screen now?
Yes, yes.
Yes. Yes, so today I would like to share our latest study in the waste worker. The title is Sacrifice Zone of Plastic, the Alarming Toxic Burden on Waste Workers in Indonesia. I am Daru. I am the Director Executive of Ecoton. I also as the researcher in the project. So we are addicted to plastic because in every day we consume too much plastic that the capacity of the waste management system can handle. So in Indonesia, only 20% of the population that have access to waste management. But our disposable lifestyle is creating tremendous environmental costs. First is the climate crisis because the life cycle of plastic from its creation to disposal is a significant source of climate warming emissions. And second, plastic is also creating environmental pollution. We see that plastic waste piled up in the landfills of legacy waste that can take hundreds of years to degrade. And third is microplastic. As plastic break down, it from tiny particles that contaminate our environment, and even it's already contaminated our food source, air, and water, and in our body. The placenta and the unborn baby is already contaminated with microplastic. And fourth, the chemical exposure from plastic contaminate or poisoning us with a toxic additive, endocrine disruptors, and also harming the wildlife. And waste workers live in sacrifice zone. In Indonesia, waste workers are facing multiple hazards, and as informal workers, they have lack of safety regulation, protective gears, and healthcare access. And because of the daily life, sorting mixed waste exposes waste workers to a cocktail of toxic substances, putting their life at higher risk. The mechanism of exposure of the toxic plastic chemicals to the waste worker happens in three main ways. First is through the skins, and by breathing and by swallowing, because they can accidentally ingesting contaminants by touching their mouth with their dirty hands. In the project of biomonitoring research, Ecoton collaborate with Airlangga University, Faculty of Medicine, and Wonjin Institute of Occupational and Environmental Health. And we collect sample of blood and urine from the waste worker to analyze the plastic chemicals. And the results showing alarming warning because we found that the one of the toxic phthalate, DEHP, raise really high concentration, and it 2 times higher in the waste worker compared to the control group. And if we compare the result to other country, the result in Indonesia is one of the highest compared to the other country, and very high, exceed the safe standard. DEHP is one of the polymers that used in production of polyphenol chloride or PVC and polyurethane as the most significant polymers used by the consumers. And the percentage in the product can be 10 to 35% in the product. And in EU already banned the DEHP and other phthalates DBP, and the maximum concentration in product is 0.1%. But in Indonesia and many Southeast Asia country, we still don't have the regulation to ban this proven toxic phthalate. Another compound, the BPA, also we found 2.3 times higher than the control group. And BPA is also highly concerned chemicals because it's create health problems like carcinogenic effect. And the phenols, the BPA we found is higher, almost over 2 times higher in the waste worker than the control group. So this result conclude that biomonitoring study on waste worker revealed occupational exposure to hazardous chemical originating from plastic. And despite the limited sample size, this study established scientific evidence confirming the internal exposure of female waste worker to hazardous chemical. This study also is significant as it provides data to support policy for the protection of waste worker, improve the public health and chemical safety within the local community, and regulate the toxic chemicals in product and in the production of plastic. So this is the health effect of phthalate. When the phthalate released in the environment, and our body can absorb the phthalate, and then it can lead to DNA methylation, and it can cause the disease or health conditions such as obesity, diabetic, cancer, respiratory, and so on. So how we can improve health protection and knowledge in Indonesia case, we recommend the health sector to establish regular mobile health clinic at the landfill sites for screening, biomonitoring, the blood and urine and respiratory function. Also provide training on chemical hazard and safe handling, and create education materials. And we know that reduce is the real solution to our plastic crisis, not to recycle. So reduce and reuse is the right solution, because recycling itself is energy intensive and more expensive than creating plastic from virgin fossil fuel. So recycling also will emit more pollution and release more microplastic and toxic chemicals. And to protect waste worker health for fair transition, we need to change the wasteful system that harms the environment to one that's circular, safe, and sustainable through reduce and reuse, refill, and replace single-use plastic with organic or plant-based material that easily will degrade or composted in natural ecosystem. And respecting the principle of do not harm and health as human right, the ethical principle will guide medical practice, should also apply to policy. And health as a key indicator of success. So when we implement new circular economy, the model is not a true success if it continues to expose workers to toxic substance. And then we need to investing in worker health to create a more stable and productive workforce. Health professional can be the champion in just transition with the waste workers, because health professional own combined scientific credibility, direct experience with health impacts, and ethical commitment to healing that could transform the abstract concept of just transition into tangible, achievable reality for the workers who deserve it most. And health professionals are among the most trusted member of society. So when doctors, nurses, and public health experts speak about the health hazard of waste work and the benefit of its transition, their message carries significant weight with the public. Health professionals can empirically document toxic cocktail hazard that waste workers face through their biomonitoring study, epidemiological study, and clinical reports. And health professional can see the direct human cost of environmental justice through providing treatment, education, and prevention, and distribute resources to help the waste worker improve their protection during their works. And of course, they can promote healthier practices. So these are what we can hope from the health professional to support the just transition with the waste workers. Thank you for listening, and I send it back to Mitch.
Thank you, Daru. What a great way to start our session. I would like to highlight that I love Daru gave us real data and biomonitoring data on the health impacts on workers, especially female waste workers, because today is Women's Month. So I love that. Thank you, Daru. So for our next speaker, please make sure to select English in your interpretation. So Aloha is the president of Dumaguete Waste Workers Association and the Philippine National Waste Worker Alliance. She has been a waste worker for 8 years. In addition, she is a dedicated advocate for the rights of the waste workers or informal waste sector in the Philippines. She and the Philippine National Waste Workers Alliance lead the national campaigning efforts for the Magna Carta for Waste Workers, a landmark legislative push aimed at securing formal recognition, health benefits, and social protection for thousands of workers across the Philippines. So the mic is yours. Aloha. Thank you.
Very good afternoon, everyone. I am Alua Santos. I'm here in Dumaguete City. This is the presentation for the just translation for the waste workers from the Philippines. Just translation for the waste workers and health ng mga waste workers sa lahat ng mangyayari. Para magkaroon ng tamang just translation, dapat priority ang health ng mga waste workers. Dahil kami ang nangangalaga
Hello
sa
everyone, I am Aloha
dapat alagaan
from
natin ang health ng mga
the
waste
Philippine
workers.
National Waste Workers Alliance, and my presentation is about just transition for waste workers.
Next.
Next slide, please.
Next. Ang PNWA, ang Philippine National
Our
Waste
alliance is the
ay
first
unang
network
alyansa
for
ng
waste
mga
workers,
workers,
waste pickers,
pickers,
junk shop owners,
junk shop
collectors,
owners,
and street sweepers,
collectors,
river
street
cleaners,
sweepers, river
electronic
cleaners,
waste
office
cleaners,
workers,
among
at iba
others.
pa. Millions of
We have
members
millions of
waste
members
workers
across
in
the country working together to fight our rights, benefits, and security at work.
Next.
Next, please.
Next. Broken waste management
Part of
system.
our work is challenging
Ito
broken
po ay
waste
nangyayari
management
dahil
system.
sa false
Improper
solution.
waste collection and management
Maling
practices are
sistema ng
still
pamahalaan.
rampant.
Kung paano
One of our
natin
frustrations is the fact that we, waste workers, are not equitably recognized as significant stakeholders. This is one reason why fatal man-made tragedies occur, such as the tragic landfill landslide incidents that recently such as tragic landfill landslides incidents that recently happened in the Philippines, in Cebu, and in Rizal. Waste workers were the first ones in danger. Unfortunately, both incidents have led to life casualties. We are the frontliners.
No waste workers left behind po sana.
We only want that no one, including
Paano po
waste
ang
workers,
circular
will be
economy
left
kung
behind.
sa paraan pong ito ay hindi po kami na-recognize? Dapat isama kami sa mga palisiya.
Waste
Ang
workers
mga
should be
waste workers
included
po
in the
ay
circular
dapat
economy
kasama sa usapin
processes,
kung basura man ang pag-uusapan at lalo na po
whether
sa
it's
mga
about
proteksyon
waste
at
management
sa amin pong mga
or
karapatan.
protection policies for waste workers.
Sa pangyayari po na ito ng false solution, kaya nagkaroon po
Another area of
ng
our work is on false
sa
solutions,
Dumaguete City po.
or any ideas or actions that claim to solve environmental issues in some way, but in fact do not. For instance, in Dumaguete City, next slide, please.
Kaya dahil po sa
Waste-to-energy facilities were established.
nagkaroon po ang Dumaguete
These
City
incinerators,
ng
also
pyrolysis
known
o
as pyrolysis, were put
False
up since
solution po ang
2021.
tawag po dito.
This is an infamous example of false solution to the
Since
climate
2021,
crisis.
pumili po ang aming pong lokal na government ng incinerator o pyrolysis.
This was
dahil
established
ito
by our
daw
local
ang magbibigay
government
solusyon kung
because
paano
accordingly,
mabawasan
this
ang
is the
basura
solution
na
to reduce
kinukolekta po sa aming
our
lahat ng barangay.
waste
Dahil po pinasarado po ang aming
consumption.
website Kaya po nagkaroon ng Central MRF po sa Dumaguete City at dahil po sa volume ng mga basura hindi na po kaya ng aming MRF, kaya bumili po ng incinerator ang aming lokal. Dahil ang akala nila ito po
Our
ang
local
solusyon
government thought that this
para
was the
mabawasan
solution
ang
to
nakuliktang basura.
reduce
Ito po
our
ay
waste
kanilang
consumption
sinusunog.
and production. They
Ang
burn our
abo po
waste.
ay ginagawang hollow block. Ito ba ay
They
nakakatulong?
turn it into hollow
Hindi.
blocks.
Ito
Does
po
this
ay
really help?
nagbibigay purwisyo
No, it does
sa
not. Instead, it
kalusugan,
just worsens the situation
lason sa
by
ating
contributing
planeta,
negative
sakit
impacts
na idinudulot
to
sa
human
ating
health,
mga waste workers,
specifically
lalo
by
na po sa
emitting harmful
komunidad namin.
substances and causing
Ang
pollution.
Dumaguete City po, sa ngayon po ay nagbago na
At
po
the
ang
moment,
lahat.
Dumaguete
Dahil
City is trying to change.
kaming mga waste workers ay hindi po dapat ang unang magkaroon ng ganitong sitwasyon dahil kami po ang frontliner. Kami po ang
We hope
araw-araw na
that we
bumaharap
waste workers are
sa
not the one who
basura na
face
klase-klase ng basura
these
na
kinds
hindi po
of negative impacts
hindi
to
wala pong
the human health.
segregation. Kaya kawawa ang mga kasama naming mga sorter, recycler po doon sa aming MRF.
We
Kaya
are the
po, kaming mga
frontliners
waste
in the waste management
ang
process.
gumawa ng paraan
So
kung
we, the
paano
Waste Workers
masolusyonan o
Alliance,
itigil ang paggamit ng
looked for ways
incinerator o pagsunog ng mga basura. Next. Kaya ang Dumaguete Waste Workers Association po,
For instance,
pinaglaban
the
po
Dumaguete
namin na
City
ito
Waste
po ay
Workers
masarado.
Association fought
Kasama
for the
po
closure
ang
of the
aking mga waste
incinerator
workers,
in Dumaguete
kasama
City,
po ang aking Vice President po ng Dumaguete Waste Workers,
together
kasama ng
with
mga
some
NGO,
members of the local government and
mga
non-profit
estudyante
organizations,
na
student
handang
organizations
protektahan ang aming
who were ready to
ang aming
fight
bayan o
to
aming
protect
barangay o aming city.
waste workers and the
Maraming
community.
salamat po sa tulong ni Ms. Percy Ferrer at saka sa kanyang asawa na
Thank
si
you to the
George
help
Emmanuel.
of
Kung wala pong
Ms.
doktor
Mercy Ferrer
o
and their organization,
health professional na tumutulong sa amin,
there were
upang
no
malaman namin
doctors
kung
or
ano
health
talaga ang
professionals
kalagayan ng aming
who
city.
helped us in
May
making us
malalang
understand
hapakaming
what was actually
hangin
happening to us.
na hindi nakakalason, na walang polusyon.
Because we were already
Nakikita po ninyo dito po
absorbing
sa picture
air
namin,
pollution due
yung
to
white po.
those false solutions.
Yan
As you
po
can see in the photo, we are
ang
wearing
air
something
air
white.
quality monitoring.
That is
Kami
a
po mismo
air
ang
quality
mga
monitoring
waste
device.
workers ang namumulo,
We waste
nangunguna
workers are the
sa
ones leading
pag-monitor po na
in
malapit
monitoring
po
the air
sa
quality in our area,
para
specifically
maadla po
near the
namin kung
incinerator
talaga bang may
facility,
lason o polusyon ang hangin na aming
to
nalalaman.
know whether
Dahil
the
po sa
air
tulong ng
in the
mga
area is
NGOs,
harmful.
mga health
Through the help
professional,
of NGOs
ito po ay nagkaroon
and health professionals,
po ng katiwasay po sa amin
we found
dahil
solution.
doon po nakikita namin na hindi
Because through
na
it,
po talaga malinis ang aming
we
nalalanghap
found out
at sa mga likidong nanggagaling
that
po
we are
sa
no
incinerator
longer
na
breathing in
napupunta
clean
po sa
air.
dagat at sa mga ilog po ay hindi na po ligtas.
And pollutants
Kaya
also go
marami pong
to
salamat sa
seawater,
mga health professionals
to
po
land,
dahil po
even
sa
to land
tulong
areas.
na makuha po namin at makamtam namin ang aming pong mga karapatan
Thank you
at doon
to
po
those
na isarado
who
po
helped us
ang
understand
incinerator sa aming pong
the effects of the incinerator to our health.
kaya po malaki ang aming pasasalamat. Kung wala po
We're
mga
very
health
thankful
professionals, wala po mangyayari. Kawawa
because if there
kami
were no
mga
health professionals who helped
workers
us through the
dahil
project,
kami po ang mga
we would not have
frontliners. Kami
understood
po ang nakatutok kung paano i-manage
significant
ang mga
impact
klase-klaseng basura.
of the
Kami po
waste to
ay
energy
nakakatulong
facility
sa
to our
aming
communities.
ating kalikasan, sa ating planeta. Kaya dapat po tutukan po ang mga waste workers. Bigyan ng mga
I hope
benepisyo,
that waste
lalo na
workers
sa
will be
health
given more attention and will be able to
para po
receive
sa aming mga waste workers.
equitable
Dapat
benefits.
Dapat po kami ay alagaan. Kami
I hope we will be
kami po
taken care of better.
ay ang environmental dapat po ay ang environment po ay ang aming inalagaan, kaya dapat kami ding mga
We
waste
are
workers
trying to
ay
take care
ay
of the
patuloy
government,
alagaan.
and we hope there will be someone who can protect us as well.
Ang Magna Carta for Waste Workers po, ito po ay nabuo nang dahil po sa aming mga waste workers.
Our Magna Carta for Waste Workers were also created
Nagkaisa po
through the
sa
Alliance.
layunin. Nagkaroon po kami ng pag-uusap na dapat
We've had discussions.
aming hinanaing ay dapat po maibigay sa ating gobyerno po. Lalo na po na maipasa po ang Magna Carta for Waste Workers para po sa
We are
aming
trying to
mga
fight to pass
karapatan
the Magna Carta for waste workers to ensure
meron po kami
that we are
isang
equitably
demands po
benefited
ng Magna Carta na dapat po
from our
kami ay
work.
tulungan na maipasa
That
po
the government, we are
kasi po
asking
sa
for your
habang panahon
support
hindi po pwede
to help
gamitin
us pass and
upang
forward
sa mga
this
karapatan
Magna
dahil
Carta
kami
for
po
waste
ang
workers.
humaharap araw-araw
We are the ones facing
sa
communities waste
mga
every day.
pollution, toxic po. Kaya dapat po ibigay po ang nararapat para sa amin. Ito po yung aming mga demands po. Una, enforcement of labor
These are our
standard,
demands.
hazard pay,
Enforcement of
health
waste
insurance
standards.
and services, humane and self-working condition, job security, just compensation, meaningful participant policy making, right to organize, social benefits and protection, training. Dapat po, ito pong lahat ay dapat po maibigay po sa amin para po sa aming mga karapatan. Dahil kami po,
Those are
ang
part of
una,
the demands of our fight for the Magna Carta for waste workers.
Planeta, lalo na po sa ating mga komunidad. Kaya just transition po ay
We are
amin
really
pong
calling
dapat
for a just transition,
at ibigay po
and we
ang
should
mga
really
health
fight for it.
insurance po. Ibigay po ang aming mga karapatan,
And hopefully the cause
para
of the
po
waste
sa
workers
aming
will be heard.
mga waste workers na makamit po namin ang aming pong mga pangangailangan. Magna Carta po, ipasa na po natin, tulungan niyo po kami para maipasa na
Please
po.
help us pass the Magna Carta for waste workers. That is the end of the presentation of Miss Aloha.
Thank you, Miss Aloha, for that very inspiring story. If I were to share one word in connection with waste workers and health professionals, is that we are all frontliners. They are frontliners in terms of managing waste, whether it's in the Philippines or other Southeast Asian countries, while health professionals are also frontliners. Hence, this is a very important topic to discuss. So we see you, Ms. Aloha, and all the waste workers. We hear you, and we hope to be beside you in your fight in the Magna Carta for workers. Now, last but not least, in sharing his story on the green economy workers' perspective, Dr. Suherman is the founder of the Indonesia Health Promoting Hospital Network and serves as the board member of Kebumi, the Indonesian project of Healthcare Without Harm's Rice Alliance. Specializing in green hospital architecture and healthcare revitalization, Dr. Suherman is a leading voice for environmental responsibility in the medical sector. He advocates that health professionals must be ready to minimize and tackle the impact of climate crisis and ensure justice in the era of carbon credit economy. Dr. Suherman, mic is yours.
Yes, of course. Thank you. Yeah. Excuse me, before we started, you have already changed my presentation, please, from Kayla.
Yes, it's already up, Dr. Herman.
Okay, thank you so much. Thank you so much for the kind hospitality inviting us to share our working in the frontier to discuss about waste and the green economy. I think we from Indonesia, mostly from the hospital, Indonesia have maybe around 3,000 hospital and maybe 20,000 clinic around the archipelago of Indonesia. Yes, maybe 10% of the total is very inclusive with the 10 agenda of WHO, how to maintain about the global green and healthy hospital. Based on this issue, 10% of all of the health facility hospital joining with us is very concerned to take a part in the management of the waste, because waste is one of the 10 agenda of WHO, from the leadership into the procurement. Waste is one of the attention. If we look about the waste, maybe I am as a public health worker, I think I'm very closely related into the issue of the environmental surveillance epidemiology, because we know that waste is one of the source will be to contaminate about the ambient, and from this issue we can also that the inequitability of balance of the ambient. So based on this, it's one come to become a polluted. This is the conceptual framework of the waste in the concept of the health issue. We know that the health professional now is very closely issue in the shifting paradigm. What is the shifting paradigm? Because we know that in the beginning, health is only concerned by the health professional itself. But now, maybe after the issue on the COP and other, maybe health is very included with the climate and also the dump onto the climate crisis. So it is quite different perception and the outcome perception and policy of the based on the Cohen note that maybe there is only healthy people in the healthy planet. So I think this is the issue. What's the environmentally goes the pushing to the health facility management to change their mind. Please, slide please. If we know about the issue on the hospital and the clinic window, and you know that maybe in every start of the years since 2023 until 2025, it is quite different outcome and then commitment between the hospital itself, maybe regional, local, and also national. We know that it's quite different outcome and performance of the variable and parameter include what this issue. We know that the enabling global solidarities among the, because we know that health professional is not preparedness in every situation. And the second is very, very better. A renewable energy consumption plan in our environment is very closely related with the fossil dependent. Based on this issue, people know that the shifting parameter and shifting variable for the health outcome performance in that slide. Next slide, please. The Indonesian National Action Plan for the Climate Change and Mitigation to become responding differently, because after we adopting about the universal health coverage from the situation, maybe 98% from the total population citizen has been covered by the national insurance. In this situation, maybe we call that the management exchange for the renewable, because renewable is come not only because about the number of patients having access to the health facilities, but also in the site, maybe the hospital or the health facility consume or maybe products a lot of waste into the site. So it is in the same side. In the other side, we know that maybe the environment is quite different, because all of the requirement from the industrial and so on maybe need more electrical plant. So that in Indonesia, maybe plants mostly by the two systems for electricity, based from the fossil power, electric power plant, or maybe by the water. So in this situation, maybe they become sometimes citizen got situation got control by the conditional. What we get from the COP, what we got in the COP 30 from the Brazil. Next slide, please. We know that the case in the Sumatra, you see, Sumatra highlights about the issue on the flooding with aspect of management and management, because about the deforestation maybe can go the hydrometeorological disaster. We know that in this situation, we know that man-made policy, it should be got more sufficient to contribute to the how the situation is become like that. In this situation, not that maybe in the global effort of the COP 30, the Indonesia was labeled fossil of the day. So because the situation is quite different, Indonesia is the production more the greatest producer of the coal, but in the other side, the prioritizing of the fossil fuel industry over emission reduction. So based on this, Geopetech generated the climate funding, but it's damage insufficient. So Indonesian initiative to fill the new emission by 2030. It is maybe more further than, because before this maybe Indonesia target maybe in the 2045. But nowadays we was prolonging because the policy implementation remain weak, such as the expansion of the indigenous people land for investor. So this is the problem what we have already suffering in the situation after and before the COP 30 in Brazil. So Indonesia taking advantage and taking initiative for how to tackling for the better situation in the case of the Sumatra deforestation and flooding. What is our commitment? Next slide, please. What is our commitment and reality? We looked at maybe issue on the biometeorological disaster. Maybe they show that the 3 provinces in the Sumatra is not only about the flooding itself, maybe indeed inside is where there is some deforestation product. So as we look in the picture, there is a lot of situation, and some of the people, citizen around, maybe damaged or maybe missing link. So the commitment will not only come from the local government, but also the central government. We don't want that this is the own problem that we don't receiving any support from other country. While now I know that maybe one of the number vote is also supporting for this situation. But nowadays, the situation is not quite clear because we are not stopping about the impact of the flooding in the short, but also we should thinking more about the palm oil industry policy. Okay, next slide, please. How the Indonesia in the side of the health promoting hospital, we have to take issue for the encouraging and also for enabling more hospital director, hospital management to taking up in the green leadership in the healthcare. So we are in the National Conference of Health Promoting Hospital, taking the initiative of workshop how to measuring hospital carbon footprint using the climate impact and check-up tool. We have already implemented into 1 or 3 hospitals in West Java and also in Sukabumi. How we finding that about the climate check-up was already been adopted from the outside can support that maybe we know that the problem is and what should be the health facility taking action for the situation. Using the advocacy of toolkit to address plastic pollution and healthcare. We know that some of the most segregation hospital or health facility waste is about the plastic and styrofoam idar sadet. The communication strategy for the climate and the health is to extending into the resiliency and sustainability. We know that not so much health facility has already engage with the capacity and capability to tackling how the green leadership initiative has been trying to implement in their own health facility. Next slide, please. From this side, maybe HPH and Kabumi as one of the part of our activity of the HPH Indonesia, we have any collaborations with so many NGO and also maybe university to tackling about issue on issue on the facilities and the climate change and the health with the program in the worker communities. And we also support by activities include the per capacity building and then advocacy. But the other side, we also bringing facility from the health to support the community surrounding in this project to taking advantage was by the advantage to support by the eyeglass renewable. Kabumi collaborated with some organization like maybe it's very wide in Indonesia's perspective, like WALHI, who is already not only local NGO but also very closely with other regional, but also university like Universitas like Gajah Mada, also the Greenfield from it. So it is some kinds of the and also some of the spiritual organization Muhammadiyah to taking advantage of this situation. And also the most important thing, we also close related with CCROM, one of the research facility from the institute from agriculture in Bogor to getting the expectation from the air monitoring. So based on this, we would also taking advantage with this. Please, next slide, please. Here is our issue who have already been capacity building even was already by the Kabumi and also by the Indonesia Health Promoting Hospital. In the issue of the climate health, we also train some maybe from since beginning from the kids and the elementary school. Into we also taking issue from the teenagers and also from the senior and also taking with several national motivator and also from the NGO surrounding in local and also the international. So this is the capacity building event has already been done, and also we got a lot of what's snowballing cadre and capacity to share not only by ourselves but also we can share the issue to send to the kindergarten into the senior citizen. Here is also next slide, please. What we saw that maybe in this side. Next slide, please. We also giving the facility and then some support by the collaboration to facilitating the children and also the youngest to got special attention because one of the affected urgent in the mankind is about the eyesight. Because we see we all joining with the one of the ophthalmologist governance to take issue in this situation. And we don't not only screening, but also we got supporting for the replace of the damage of the children and maybe of mankind of the automated itself. What is the research of activities? What we have? Next slide, please. We have already combining with CCROM from the IPB to looking for the issue of the air monitoring near the coal-fired power plant. In Java Island, maybe we get putting maybe in West Java, Central Java, East Java, and also the Banten and the West Java. Maybe also we go now moving in the third year to go to the Eastern Indonesia, like in Maluku and like in the Celebes. What we find in that, maybe we know that air quality monitoring to fill the information gap in the primarily equal to fine pipe and 10 and maybe on the air humidity temperature. We got some real-time information about this, and we know that only the real-time information take once of the agent to intervenes to the citizen and society, and we know that maybe about the quality of the temperature and then the quality of the humidity, and got some difference. Maybe mostly of the people surround, mostly in the east of Indonesia, because the power plant is quite huge capacity in the production of the electricity. So most of them is very dry ice. Dry ice is one of the entry point for the to determine the battle of pollutant pattern and exposure level. So the communities around got coal prior plant got damaged because of the situation. Exploring the data and information from the public and the expert of prior policy accommodation and action to support Indonesia commitment to a just energy transition for the health and advocacy. We have already done in the several provinces with bringing data into the NGO, and we talk together how to maintain local or regional policy and also to support the national policy to tackling, because we know that the cut off of the what we call the cut off it is quite lower rather than WHO already declared. So we hope that maybe Indonesian government, maybe provincial and also local government, to improve the ambience of the level, and then to take more people more well protected by the situation. Improving public health and ensuring the right to life to the healthy and conducive environment. We have also the dashboard online based on the airborne. The other issue of the kinds of the PM2.5 and PM10 and we can also looking for another finding outside, because before this we have already in some facility has already putting commitment on the about the zero mercury exposure, because now we know mercury is only by the hydrometer, but in the same time maybe we look another. This is one of the activities has already been showing how we have already put together with the people surrounding, and then we hope that maybe we would like to more taking advantage for the decision making based on the evidence. The last is about the issue on the mercury from the cost of the power plant. Here in Indonesia, until now there is electricity is still going up in 60.5% cost base, but we would make the mercury emission we can do detected concern. But next maybe we would like go the same research with the ICG-ROM to get the how to purpose it. But in other country, maybe like the US, the mercury come from the power plant is quite dangerous, because not only in the health facilities but also surrounding the health facility, but the effective from the damage. I think this is my presentation. Sorry with the changing slide from the short time, but hope maybe it more clearly to got some better perception from audience about what have been done by HPH Indonesia and also Kebumi. Thank you so much.
Thank you, Dr. Suherman, for your story and sharing your frustration on the COP30 results and policy implementation. It is important for us to see on-the-ground stories on commitment versus reality, and Dr. Suherman has highlighted that in his presentation. So let me just ask our speakers if, given that we don't have much time for the open forum, apologies for that, but please, audience, feel free to stay just for a few minutes because we still have our last speaker. But for the three speakers for our interactive session 2, please give a few words on your messages. Since our audience are health professional, what is your message? I'll start with Daru, please.
Yeah, for just transition, in the waste issue, yeah, I think it's important to understand the chemicals used in plastic and its health impact. So we can push for a global regulation to ban the toxic chemicals in the product. And we cannot achieve circular economy unless we ensure that these toxic chemicals are not being used in the process. But now the recycling and the circular economy is still not safe because recycling even more disperse these toxic chemicals to the environment and to increase the risk for health risk for the waste worker and the community. Thank you.
Thank you, Daru. How about you, Miss Aloha? Do you have any message to our health professionals?
Ang mensahe ko lang to the health professional with them is tulungan nila kami dahil sila po ang champion sa usaping kalusugan ng mga tao. Kalusugan ng planeta, sila ang may pinakamainam na magpaliwanag na ang climate action ay health action din. Sila po ay may kredibilidad bilang mensahero. Sila ang may alam sa maling solusyon na sa madaling salita, sila ang tulay sa pagitan ng hustisya sa kalusugan na tinitiyak na ang hinaharap na ekonomiya ay nakasinto sa kapakanan ng mga tao. Yan lang po.
Thank you, Miss Aloha. If ever you missed that in the interpretation, we will highlight that in our blog post. Thank you, Miss Aloha. How about you, Dr. Suherman? What is your message to our health professionals?
Yeah, thank you. I think in the evaluation of the situation of the climate crisis compared to health, I think the issue needs for the eco-theological contemplation from the bureaucracy. Because if there will be not with the spiritual report drive, we can waste about it. The second is about the carbon credit from the next future, because the global investment until now maybe should be shifting not only for the investment itself, but also how to got the fairness and also the involvement of the local citizen to involve in that policy. Thank you so much.
Thank you, Dr. Suherman. And that was a really great discussion from our speakers who are the human books who just shared their life stories. Now let us connect Just Transition with social determinants of health and how it links advocacy around environment, health, reproduction, climate, and other pressing problems. So let me introduce Rally, our climate officer, who will relate these two. And please stay for a few minutes because we're almost ending. Thank you. Rally, the mic is yours.
Okay, thank you so much. And thank you for our speakers for sharing your thoughts, your expertise to us. So please bear with us for another 10 to 15 minutes. We'll make this very, very quick. Excuse me for my cat. Okay, so as mentioned, I am Rally and I am the Climate and Health Project Officer in Healthcare Without Harm, Southeast Asia. So next slide, please. The foundational medical oath is to first do no harm. But in the 21st century, we must recognize that we cannot protect the patient if we do not also protect the planet. So today, we are exploring the intersection of the social determinants of health and what we call just transition. So a shift toward a sustainable future that prioritizes equity. So emphasis on equity and well-being for all. Before we start, let's ground this in your daily practice. I want you to think of two patients or communities you serve. So maybe one is located in a legacy industrial or a coal-dependent area, and one in a newly developed green tech hub. So take 1 minute to jot down in the chat section ways their environment, maybe air quality, access to transit, dictates their risk for chronic respiratory or cardiovascular disease. So I'll give you 1 minute. It's 3:28 now. So examples, water quality, air quality. No answers yet in the chat. Okay, maybe I could answer my own question. Okay, so we have economic stability, healthcare access. Some of these are just examples of social determinants of health. So this exercise just highlights why health professionals, you, must be leaders in the transition from coal-dependent to sustainable sustainable healthcare and such. So because, of course, we see the biological cost of environmental injustice every single day. Next slide, please. To understand why we are talking about this transition in health, we first have to look at what actually makes your patients healthy or what drives them into your clinics in the first place. So if you look at this visual, you'll see a striking breakdown of the determinants of population health. So this is actually from the Department of Health, Philippines Health Promotion Bureau. So as health professionals, you often spend your entire day focused on the bottom 20%, which is the green zone. So this represents clinical care or healthcare access. So the moment a patient is inside your facility, the quality of care you provide and their access to you is this 20%. But notice the top half of this graphic. A full 50% of health outcomes can be traced directly back to a patient's zip code rather than their genetic code. So socioeconomic factors, we have 40%. This is the largest piece of the pie. It includes your job status, income, and education. So a just transition is essentially a massive intervention here. So when we shift from a legacy polluting industry or coal-dependent industry to a green economy, we aren't just changing jobs. We are securing the income and social support systems that keep people out of poverty and let them stay in good health. So we have physical environment, which is 10%. So this is where the climate crisis hits home, our environment, the air we breathe, the heat in our homes, and the safety of our communities directly. This dictates health resilience. So in the middle, 30% represents your health behaviors, so like diet and exercise. But as we know, it is nearly impossible to exercise in a neighborhood without green space or to maintain a healthy diet if energy poverty means choosing between heating, since we're in Southeast Asia, or ventilating your homes and buying fresh food. Next slide, please. Okay. 7 minutes more. Okay, so we think about social determinants of health as static realities we have to manage. But a just transition is the active process of rewriting those determinants. It's the bridge between climate policy and the bedside. So let's look at how this transition directly impacts your patients' daily lives. So I will just be giving a few examples, but there are a lot more. For example, housing. So we aren't just talking about green buildings. We're talking about weatherization. So this means your families, your patients have stable indoor temperatures that prevent heat stroke in the summer and asthma flares from moldy damp walls in the rainy season. Jobs. So economic stability is a primary health driver. Transitioning workers from legacy industries into clean energy roles prevents mental health crisis and deaths of despair. So when we say deaths of despair, This refers to a rise in mortality caused by drugs, alcohol, suicide, reflecting a decline in hope and life quality, often tied to economic, social, and psychological distress. That follows industrial collapse. So we have food. Food, by moving toward localized regenerative food systems, we address food deserts. So we are swapping processed, high-emission supply chains from fresh, nutrient-dense local produce. So transit, this is about respiratory health. So swapping diesel buses for electric transit and bikeable paths immediately clean the air in our vulnerable fence line, or as one of our speakers earlier said, the sacrifice communities. So to simplify this ROI, we follow this flow. We have the climate risk. So we start with quote unquote pathogens in the environment, pollution, waste, extreme heat. We then apply transition fix. So we apply the treatment, renewable infrastructure, your green economy, greening your neighborhoods, which directly translates to a health win. So this is the clinical outcome, which is very clear. So we see clearer lungs, better nutrition, and a reduction in chronic stress that drives cardiovascular disease. So as health professionals, we don't just treat the smoke, we advocate for the transition that puts out the fire. Okay, so next slide, please. This is the heart, or rather the lungs of our argument. So on the left, we see business as usual model. So legacy industries, these are the coal-dependent industries, high particular matter, and localized pollution. On the right, so this is the just transition model. So notice we aren't just moving the bad smog. We are adding protective factors like urban canopies, renewable energy, and applying green economy. So we are transitioning from an environment that causes inflammation to one that fosters health resilience. So let's look at the data-driven prescriptions this transition provides. So when you have green economy, you have fewer ER visits. When we decarbonize, we reduce fine particular matter. So this is not a long-term goal. This is actually an immediate win. So studies show that when coal plants close, pediatric asthma admissions and cardiovascular emergencies in the immediate or sacrifice communities drop significantly within months. So fewer ER visits. And then higher green space means lower cortisol. So a just transition prioritizes greening underserved neighborhoods. So this is not just about aesthetic. It's about mental health intervention. We have a Gen Z millennial phrase, what we call touch grass. So it's actually science-based. So studies show increased access to nature is clinically linked to lower cortisol levels. So this reduces your hypertension and improve birth outcomes. So lower energy bills, next, means better nutrition. So this is a vital social determinant of health link. So high energy, high efficiency. So weatherized housing reduces energy poverty. So when a family, your patient's family, isn't spending more than half of their income on ventilating a hot home, those funds are redirected to the grocery store. So we are literally trading your utility bills for better nutrition. Okay, this is my last slide. I hope I was on time. So I'm leaving you today with this. So we often feel powerless against these large-scale shifts, just transition. But as health professionals, we must remember that only 20% of health happens within the walls of your clinics. So to the other 80% is determined by the policy and the environment. Advocacy for a just transition is simply preventative medicine at a scale. So I hope I have given you a bit of a refresher on the intersection of social determinants of health and just transition. So if you have any questions, feel free to put it in the chat box or email us. Thank you very much.
Thank you so much, Rally, for that quick but really insightful relationship between just transition and social determinants of health. It is just a snippet of a bigger picture of what we are advocating for. And since this is just our first webinar, so we have a lot more to learn. So if you want to talk, discuss, and learn more about specific issues such as just transition, let me call Mel, our climate and health manager, again to share about RISE community sharing. Mel?
Yes, hi Mitch. Hi everyone. So before we close this session, I would like to invite everyone to take part in something we are launching through the RISE Alliance called the RISE Community Sharing. Okay, next slide please. RISE Community Sharing is a social media feature by Healthcare Without Harm Southeast Asia designed to spotlight health professionals who are championing climate action and sustainability in their work. Because very often, your incredible work that is happening in your hospitals, in your communities, in your institutions, are not always visible beyond the confines of your institutions. That's why, through the RISE community sharing, we want to highlight these stories and amplify the voices of health professionals who are members of RISE. So a while ago, we showed the QR code. So please do join RISE and those leading climate and health actions across the region. So this could include your personal advocacy work, your research on climate and health, or hospital-based sustainability projects. So the goal is very simple. Share your story so that others can learn from it, be inspired by it, and eventually replicate it. So that's the idea of the RISE community sharing. So in the next slide, we can see that here are the ways for you to be featured. So if you're interested to be featured, the process is very simple. We invite you to share your key achievements. This could be your data, your outcomes, or even a short story about the work that you are doing. So throughout the year, we will also highlight initiatives related to several themes, including just transition, health impact assessment, climate action in healthcare, climate and health diplomacy, but we are not limited to these themes. So you can share and we will be reviewing your submissions. So our team will be reviewing your submissions. And if you're interested in sharing your story, you can simply scan the QR code. So we'll give you time to scan the QR code once again and use the link provided to submit your story today. So your experience could inspire other health professionals across Southeast Asia and beyond and help grow a stronger movement for climate resilient and sustainable healthcare. So let's rise together, one story at a time. Back to you, Mitch.
Thank you, Mel. And that's the end of our webinar. But before we end, I would like to call on our Executive Director, Norly Grace Mercado, to give a wonderful closing message.
Thank you, and good afternoon, everyone. Good afternoon to everyone across Southeast Asia, to our partners and dedicated members of the RISE Alliance. The title of our webinar is First Do No Harm. For many of you health practitioners and frontliners, these words are your sacred oath. But today, this afternoon, we have actually expanded that oath, right? We have acknowledged that we cannot truly protect our planet or our patient if we do not protect the community or the planet that we are living in. Like those near coal plants, for example, or the waste workers navigating the toxic realities of our disposable culture. We moved from conversations about just transition into really realizing what it is. We said that it's about life. It's about the intersectionality of health, climate, and our livelihoods. We also heard about the core principles that must guide the health sector in this transition. We also listened to the powerful stories in the human library and what their challenges are. We have also
tried to come up with some ideas on how to promote a just transition. With all of these things that we have learned this afternoon, I urge each one of you to go back to your institutions, to your organizations, and start a conversation about the just transition, one step at a time. And as Mel was saying, one story at the time. It's an opportune time. It's a great time for us, for you, healthcare practitioners and frontliners, to take the lead and really come up with a story and a narrative towards a just transition. And please remember that you are the leaders in this movement, in this space. So we are hoping that you can join us in our future activities and future webinars. I hope you enjoyed this one. And thank you very much and good afternoon.
Thank you, Norly, for that message. And before we end, we would like to thank our speakers for sharing their expertise and stories. So let's show our love to all of our speakers by doing the heart reacts on your Zoom chat. And we would like to appreciate our participants' feedback through a 3-minute survey. So please answer that survey. It will help us improve in our next webinars. And to our dear participants, we appreciate spending your afternoon with us. Again, I am your host and moderator, Michelle Reyes. So thank you for spending your time with us and staying. Good afternoon. Thank you.